Hello, my name is Noelle, and I'm a registered dietitian at Torrance Memorial Medical Center. Torrance Memorial is an accredited center of excellence for bariatric and metabolic surgery, and is committed to providing the best quality care for our patients. We have developed recommendations following guidelines and evidence-based practices from the American Society for Metabolic and Bariatric Surgery to maximize healing after surgery and optimize weight loss. This video will provide an overview of the nutrition recommendations and guidelines following weight loss surgery. Patients should still, however, make sure to register and attend the full Pre-Operative Bariatric Nutrition Class, which is a requirement to receive weight loss surgery at Torrance Memorial Medical Center. The purpose of following the post-op nutrition guidelines is to ensure patients are receiving enough fluid, protein, vitamins, and minerals to stay healthy, preserve muscle, optimize healing, decrease side effects of surgery, and minimize unnecessary complications, minimize food intolerances, and overall promote weight loss in the most nutritionally sound manner after surgery. Let's review the diet progression that patients will follow after surgery. While in the hospital, patients will start on a thin liquid diet and typically remain on this diet for an average of 3 to 7 days. But this phase can last up to 10 days depending on the surgeon's assessment. It's important that patients do not advance to the next stage of their post-op diet without first receiving approval from their surgeon. This phase consists of fluids that have a thin viscosity and flow readily like water. Aside from water, patients can have broth, herbal caffeine-free tea, and protein drinks. An exception to this will exist for patients who need to take certain medications that are not available in liquid form. In this case, patients will take their medication crushed up, if not contraindicated, and mixed into a small amount of unsweetened applesauce. Now that we've discussed consistency, let's discuss protein and hydration goals for the thin liquid phase. One of the parameters that patients need to meet prior to being approved for discharge from the hospital is nutrition related. Patients are required to consume and tolerate a minimum of 60 grams of protein and 48 ounces of fluid in a day. The hospital will provide patients with protein shakes and a pitcher of water to meet this goal. If there are concerns about intolerance to the type of protein supplements offered by the hospital, please discuss this beforehand with your bariatric dietitian to plan for alternative options. To prevent nausea and vomiting after surgery, patients are recommended to take small sips and to sip slowly. To help with this, patients will be given 1-ounce medicine cups and are encouraged to sip their water from these cups. The goal is to sip at least 1 ounce of water every 10 to 15 minutes or more is tolerated. Please note that the protein shake is not counted towards the total fluid goal. The 60 grams of protein and 48-ounce fluid goal only applies as a minimum tolerance goal for discharge from the hospital. Once patients return home, the goals increase to a minimum of 80 grams of protein per day and a minimum of 64 ounces of fluid per day. Each patient will have individualized protein goal, which can be as high as 120 grams of protein or more per day. Realistically, it may take patients around a week to build tolerance and be able to consume the full protein goal. It is important to meet these daily nutritional goals to promote healing, preserve muscle mass, and avoid dehydration. Patients will meet with their surgeon to assess their surgery progress and whether they can advance to the next phase of the post-op diet. Once the surgeon deems it's appropriate, patients will transition from thin liquids to a pureed texture. The consistency of the pureed diet is smooth with no lumps or chunks. Appropriate foods include soups, non-fat milk or lactose-free alternatives if patients are lactose intolerant, runny cream of wheat, pureed meats with broth, pureed cooked beans, non-fat plain Greek yogurt or regular yogurt, unsweetened pureed fruit, and pureed cooked vegetables. It may be helpful to use a blender during this phase to ensure a smooth consistency. When putting foods through the blender, we recommend straining it to catch any lumps that the blender may have missed. Starting on the pureed phase, patients need to avoid eating and drinking at the same time. We recommend to stop taking fluids 30 minutes before meals and to wait at least 30 minutes after the meal is finished before resuming fluids. This is to prevent intolerance issues like nausea and vomiting from occurring. This phase normally lasts between 1 to 2 weeks. Again, it's important to remember that the surgeon will designate when it's appropriate to advance to the next phase of the post-op diet, and patients are not to advance themselves without the surgeon's approval. The phase following pureed is soft and bite-sized, which consists of foods that are easily mashed with a fork. This phase of the post-op diet normally lasts around 2 to 3 weeks. Foods that fall within this category include scrambled or poached eggs, soft fish like tuna, tilapia, cod, and sea bass, soft, low-fat dairy products like cottage cheese, ricotta cheese, Greek or regular yogurt, tender skinless meats, making sure that it's chopped or ground, legumes that have been mashed. Some examples include black beans, kidney beans, garbanzo beans, and white beans, to name a few, tofu, well-cooked vegetables, and soft or canned fruit. Please note that it's recommended to avoid the fibrous vegetables, like asparagus and celery, which may cause blockage, and to limit cruciferous vegetables in the beginning to avoid excess gas and abdominal discomfort. Also, when it comes to canned fruit, make sure it's packed in water or light syrup and to drain the liquid before consuming. We suggest using moist cooking methods such as boiling, poaching, slow cooking, stewing, or braising. Do not bread or fry your foods. Also, it's recommended to limit spicy foods for the first few months after surgery. However, non-spicy seasonings are safe to use. Continue to avoid eating and drinking at the same time, waiting the recommended 30 minutes before and after meals to drink fluids. Patients should also always be working to meet their daily protein and fluid goal. Finally, we have arrived at the last stage of the post-op diet, the regular diet. It's also considered the maintenance phase, where the emphasis is to keep a healthy and balanced diet to maintain the weight loss patients have achieved. The regular or maintenance diet typically starts around 6 weeks post-op. It is normal for patients to start by having 5 to 6 small meals a day, and then over time progress to a more regular meal pattern of 3 meals with 1 to 2 planned high-protein snacks, depending on their individual needs. Some reminders and goals to keep in mind include to maintain a minimum intake of 80 grams of protein and 64 ounces of fluid every day, half of which should come from plain water. To start every meal with eating the protein portion first, then move to the vegetables second, and if stomach space permits, incorporate a small amount of high-fiber carbohydrate or starch as the very last food group. Do not eat and drink at the same time. Expand food choices as tolerated by introducing one new food item at a time, and to continue to supplement with protein drinks if patients cannot meet their daily protein goal from food alone. Another key item the patient should remember is to take their vitamin and mineral supplements every day for the rest of their life to ensure they do not become deficient in crucial micronutrients needed for overall good health. There are several reasons why patients will need lifelong supplementation, including the modality of the surgeries themselves, which will either produce a degree of restrictive eating and/or malabsorption. It's also common for patients to exhibit reduced stomach acid production, which makes it more difficult to absorb certain nutrients. This is due to the smaller stomach size and at times to acid-reducing medication. It is important that patients take their supplements as directed on the bottle unless otherwise specified by their surgeon. The surgeon will regularly monitor their patient's blood values and adjust the regimen as needed. The majority of patients are recommended to take a balanced and complete adult formula multivitamin, iron, B-complex, and calcium supplements. There are a few key items to note to optimize the absorption of the nutrients. First, it's recommended to take either a chewable or liquid form of the supplements for at least the first year following surgery before switching to a capsule or tablet form. Second, patients should take their iron and calcium supplements at least 2 to 3 hours apart because iron and calcium will compete for absorption if taken together. And lastly, calcium is best absorbed in doses of 500 to 600 milligrams. Therefore, if patients are required to take 1,000 milligrams or more of calcium per day, it's recommended that patients separate their calcium dose of 500 or 600 milligrams by 3 hours. Let's review restrictions after surgery. Patients should avoid having any form of caffeine for at least 30 days after surgery. This includes coffee, decaf coffee, because it still contains a small amount of caffeine, black tea, and green tea. However, herbal teas are okay to drink. No alcohol for at least 6 months after surgery, although patients are highly encouraged to abstain from alcohol for the first year. No carbonated beverages, including sparkling mineral water. Avoid using straws, which can result in excess air being swallowed and cause abdominal discomfort, bloating, nausea, and vomiting. Patients are encouraged to regularly carry water bottles with them to help maintain hydration throughout the day. However, patients should avoid using water bottles with suction nozzles for the same reasons as previously mentioned with straws. And lastly, patients should avoid chewing gum after surgery because the act of chewing gum allows air to enter the digestive tract, which can lead to gas and abdominal discomfort. Another problem is that gum can potentially lead to blockage if accidentally swallowed. Let's move on from things to avoid to discussing guidelines patients should remember to prioritize. First, patients should prioritize protein intake by making sure they start every meal by consuming the protein first and eating it completely, aiming for around 3 ounces of protein per meal, before moving on to the remaining parts of the meal. Patients should ensure that they will be able to meet their fluid goal by drinking fluids within 1 hour of waking up and consistently sipping throughout the day. Eat slowly, take small bites, and chew food thoroughly. Patients are encouraged to put their utensils down between bites and aim to chew their food to applesauce consistency before swallowing. This improves digestion and prevents food from getting stuck. Patients should stop at the first sign of fullness before stomach pain or discomfort is felt. Patients are encouraged to track any food intolerances to review them with a bariatric dietitian. Lastly, patients must commit to taking their vitamin and mineral supplements every day for the rest of their lives. Another strongly recommended and important part of the patient's post-op journey is establishing a strong support system. It is one of the factors that powerfully influences outcomes, including weight regain after surgery. Attending regular support groups has been shown to improve weight loss outcomes, and it also provides patients with an opportunity to connect with others that are going through similar experiences and receive ongoing education on topics such as nutrition, exercise, and healthful behavior changes. At Torrance Memorial Medical Center, we offer a variety of resources, classes, and support groups, allowing patients to be a part of a reliable support system to help them push through the tough times as well as celebrate the victories. A strong indicator for successful long-term weight loss is the implementation of dietary and lifestyle changes prior to surgery. If you are ready to jumpstart your health journey and want to learn more about how nutrition plays a role, consider scheduling a one-on-one nutrition consultation with one of our dietitians. Our clinic is located in the Torrance Memorial Specialty Center, and the number to contact is listed on the screen. This concludes our overview of the bariatric post-op diet recommendations and guidelines. If you have questions regarding the bariatric program, please visit our website to learn more or contact us directly to learn what your next step should be and if this program is the right fit for you.